Hey you guys, it's Kelly Jackson, and something truly remarkable is happening here at Kingsbury Animal Hospital in St. Louis, Missouri, where they are performing their very first stem cell therapy on Duffy. He's a 10-year-old lab. His pet parents have tried everything they could for his arthritis, so this is kind of what you could kind of say the last resort. But it's also something wonderful because, as I always say, older dogs are not only living longer, but they're living better, and this stem cell therapy definitely is a testament to that.
He's always been arthritic, and they've done everything that they possibly could so that he wouldn't be in any pain. He's been on several medications, non-steroidal anti-inflammatories. He's now on tramadol, which is a narcotic, and he's had some surgery on both of his elbows at Mizzou, and now the owners are, of course, just not wanting him to be in any pain. They want him to live a long, healthy life, happy life, so they're considering stem cells. We're very excited.
Duffy's stem cells are primitive cells. They're mesenchymal cells that actually have the ability to differentiate into different types of tissue. So that, these stem cells can become cartilage, they can become bone, they can become tendon, they can become liver, they can become kidney. You name it, they can do it. Essentially what we do, it's a two-stage procedure. The first part is actually harvesting fat, which is extremely rich in stem cells, these stem cells, and we're sending that fat to California. They will then take these stem cells and collect them out of the fat, and they'll do it in a sterile manner, and then they'll ship them back to us. Now this is a 2-day turnaround process, so we overnight them to them, they collect the stem cells, and then they send them back to us.
So Duffy's tissues were sent to the lab in California, and now they were sent back here to Kingsbury Animal Hospital, where they will re-inject him with his regenerated cells, and fingers crossed, Duffy could be a brand new dog.
So how's he doing, doctor?
He's doing very well. He's got a little bit of blood in his urine, so we opted not to inject his joints yesterday, and we did some clotting studies on him to see if he had any clotting abnormalities that might preclude him from getting his joints injected. And so far everything has come back normal. So he appears to be clotting well, so we don't seem to have any risk for actually having any bleeding into his joints. If you go to inject the joints and they actually bleed into the joints, it's very inflammatory, and it will actually cause a lot of inflammation and pain in the joint. So that's what we're trying to avoid. We actually have the stem cells in our hand, and we will inject those into the joints in question, which are her elbows. We're also going to do an intra-articular injection straight into a vein so that she actually is getting some directly into her venous system, into her blood. And one neat thing about stem cells is they can actually home to the site of injury. So if you inject them into the blood, they will go where damage has been done. So if you've got osteoarthritis, they will go there. If you've had a heart attack, a myocardial infarction, they'll go there. If you've got kidney disease, they'll go there. So, when you inject these into an older dog, you're going to lose some of them to other parts of the body, because obviously older dogs, just like older people, have kidney issues, liver issues, arthritis in pretty much, multiple joints in the body. But a large number of them will get to the elbows as well. And the neat thing about the venous injection, giving it actually into the blood, is that it makes them feel that they have a high for a couple of days after you give it. So coming out of anesthesia, they feel great because of the stem cells.
How did it go?
Actually, it went wonderfully. I was a little concerned about getting the needles into the joint space, which I'd mentioned earlier, but actually got them in, got joint fluid on both, so that we know the cells went exactly where they were supposed to go. So we got very good deposition of the cells right into the joint, and I don't know if you noticed, but we were kind of manipulating the joint back and forth. That spreads the stem cells around a little bit, which is what they recommend. So we got adequate deposition in both elbows, so we are in great shape.
How long will it take before it really takes effect?
If you look at most of the anecdotal stories and talk to owners, about 30 days the dogs are doing great. Probably a little sooner than that, but 30 days dogs are moving around well, doing good, and we can have you back and do a 30-day checkup.
After all this that we've been through with him, we want to make sure to get as much of a good result as we can. So to know that we got the right spot and it's all over, we can breathe easy.